there's not just one treatment. We have about 3 or 4 different treatments that you can have.
What are the other ones that you offer, which are sort of less invasive than the cellulite?
One of our most popular ones actually is Emtone, which used to be called Unison. They rebranded the machine and it's been called Emtone now.
I've heard a lot of doctors talking about Emtone recently, and I was very confused because I was like, what is this new machine that has sort of come out of the sky? And I haven't heard of it, but it's been rebranded, obviously.
It's just been rebranded, okay. Yeah. I think because they have several other machines that start with M, they wanted to keep it in
the family.
Exactly. But that's a mixture of radio frequency with acoustic wave therapy, and that's actually probably more popular from a cellulite point of view than some of our other treatments, because it's combining 2 technologies, so you're targeting cellulite from 2 different aspects. And if you did have some really, really specific indentations that weren't improved with Emtone, then that's where you can do some fine work with something like cellulite or even an injectable treatment at that stage. But Emtone is a really good treatment, where you're having about 6 sessions over the course of maybe 3 to 6 weeks, depending on how close the intervals need to be for that individual. And maintenance for that isn't that it's not a high requirement. You're in about sort of 9 months to 12 months, you might do a few sessions again. So actually
it becomes more of your lifestyle in a way, doesn't it?
Yeah, exactly, because lifestyle massively has a huge impact on how your body will retain cellulite, or whether cellulite would be worse, and depending on the grade of it. If you're somebody who smokes a lot, you don't exercise, you rarely drink water, you have a really poor diet, all those things are going to mean that your chances of cellulite being worse is much higher.
And I think there is
a combination.
Yeah, and I think also before you approach any of these procedures, it does make sense that your body is in its most optimal state of health, doesn't it?
Definitely.
That you do sort of make an effort to eat healthily, and that you do sort of stop smoking and limit your alcohol consumption.